Today we are going to talk about a niche topic, which is the 360-degree liposuction. Hello, I'm Dr. Sheetal Londhe. I'm a board-certified plastic surgeon practicing at ZeroSize Viman Nagar, Pune. So what is this 360 liposuction? As the word itself says, it is 360-degree. That means the whole body has been carved all around and you have been sculpted to give a very wonderful body is called as 360-degree liposuction. Lipo, as the word says, fat, and suction, that means it is been sucked out of your body. What body parts have been covered in 360-degree liposuction? So mainly it is for the torso, that is the body, the central part of your body, not the limbs and arms and all. So we take care of the complete abdomen, the tummy part. Then comes the love handles, the flanks, the back pouches, which somebody have those heavy fat deposited over the hips. Then comes the bra rolls and even the scapular flap. So when all this fat has been addressed together in one surgery, it is called as 360-degree liposuction. Now, at ZeroSize Viman Nagar, when we are planning for a 360-degree lipo of a patient, the prerequisite that is there is one, very important, that patient should be mentally prepared for the surgery. Second, physicians will have a look at the labs, the tests, the x-rays, the USGs and everything, and then give us a fitness that yes, patient is fit for surgery. Anesthetist takes care of the PAC, that is the pre-anesthetics checkup, and decides that yes, this patient is safe for surgery. Then comes my role. What do? A very thorough measurement and marking is what is important in these surgeries. Because we just can't miss out any of the bulge of fat only because the patient was lying supine and then I couldn't see the fat and then we've missed it. There are also some of the dermal lines that we see, like the fat is here and the other one is here, and in between there is a big crease of the skin. That needs to be broken so that you have that smooth contour of the back and the abdomen. So these are the places which we will be marking. Okay, fine, we are going to work out here. We are going to use this energy of VASER over here. This much liters of fat is going to come out. This is the infiltration that we are going to put. These are all our calculations that we will be putting on paper 2 days prior to the surgery and mark all this on the patient's body. Okay, now in this, it's just not me who is going to decide what I have to do. It's the patient's concern also. Okay, yes, doctor, this is the part which I am worried about. This is the part that I am worried about. And then we plan the whole surgery. On the day of surgery, when we start, we will first give anesthesia and make the patient sleep on the tummy so that the back has been taken care of. There are many patients who even have, hump in the necks, just big humps of fat. That has also been taken care in this 360-degree liposuction. So the hump goes, the scapular flat goes, that is your wings wala fat. Then the bra rolls will go. As we come down, the flanks goes, the love handle goes, and the fat above the buttocks go. And the fat above the buttock goes, that buttock gets a very nice silhouette. After all this has been done, we turn the patient and then the tummy has been taken care of and liposuction is done all over the tummy. The very good part of this is if a patient is very nice and athletic, he's doing a good workout and is desiring to have a 3D liposuction, that is a high definition liposuction in which we can give them the six packs. In females, we can give those, linear lines which they look good when they wear a bikini or anything. So these are also fine things that we can do during a 360-degree liposuction. After the procedure, we will put the patient into a compression garment. The compression garment itself has its own shape and it compresses in such a way that the body will get the shape that we are desiring to give to the patient. After which the patient is shifted to the ward and immediately ambulated the next day morning. Once the ambulation starts, there is a good post-operative care given to the patients regarding how many days to wear the pressure garment, what type of massage should be done, what type of a diet should be taken, and the visits to the hospital are how many. Because I am using VASER liposuction, skin which is supposed to be, saggy or loose gets tightened because of this technology. We are also using radio frequency to help the skin tighten fast. And post-operative follow-ups also, if need be, we give few sessions of radio frequency or lipo for the skin to tighten and get into shape which we are desiring to have. This is all about 360-degree liposuction. If you have any queries regarding it or you're planning to have a 360-degree liposuction, if you're dreaming for that beautiful body, then please come visit us at ZeroSize Viman Nagar, Pune.